This morning on BRN, helping kids who don't visit a dentist as often as they should. And joining me now to discuss this and a lot more, Dr. Megha Sata is a spokesperson, I should say, for the American Dental Association, and she's also a practicing dentist at the South Bay Children's Health Center. Dr. Sata, it's great to see you. Thanks for joining us on the program this morning.
Thank you for having me.
I'm so glad we could talk about teeth and our smiles. It's so important, and we'll talk about why in a few minutes. But let me ask you just basically, for all those parents out there, are our children getting to the dentist as often as they should?
As a country, no. Okay, but there's a big discrepancy in kids from households that are in the lower socioeconomic status and kids that are not. And so, I think we can do better than what we're currently doing.
Yeah, and why is it important? Just for a basic level setting, why is it important whether we're a child or a grown adult like myself? Why is it important that we see you or someone like you, a dentist, every 6 months?
So a lot of dentistry is actually preventative. And I think that we are fortunate to be in a country where we do focus on preventative medicine, or we try to. And dentistry should not be seen as a luxury. It should be seen as part of your overall health. And so by coming in every 3 to 6 months, depending on what your doctor recommends, you can stave off a lot of issues that become really hard to deal with if you wait too long.
Yeah, I mean, things like periodontal disease. I've often heard, doctor, that it's the first sign of major disease can be your tongue, your gums, and other parts of your body. Now, you mentioned earlier about some of the socioeconomic factors that have an impact, especially in lower income families. Let's talk about Give Kids a Smile. What is the program? How does it work?
So Give Kids a Smile is an ADA Foundation program. I think they've been supporting the program for about 22 years. It started in St. Louis by a couple of private practice dentists who knew that there was a need for dentistry in the community for kids that were underserved. Many kids did not have dental homes in St. Louis, in their areas, and they thought, okay, we can do something. Maybe we can't bring all of these kids to our office, but we can do something about it. So they started a free clinic that they hosted once a year, and they scrounged together 15 dental chairs in a dilapidated building, and they got volunteer dentists to come and provide a free day of dentistry. Now that has grown, and now they do 2 free days, and it is at a dental school. And they bus in kids from schools. And really, they not only provide the free dentistry, but they provide dental education. They provide education to the parents, and it raises awareness about the need, which is great. So the ADA Foundation found out about this program. The American Dental Association found out about this program and decided they wanted to adopt it and try to grow this nationally. So now we have about 5,000 dentists a year volunteering to do a Give Kids a Smile program in some way, shape, or form. And we have, I think, over 20,000 volunteers that are non-dentists. And we serve over 300,000 kids a year through the program.
Yeah, that's absolutely amazing. And how do I find out if I'm a parent watching the program, or even a child? Or a grandparent, or some relative? How do I find out? So someone out there watching that wants to help a younger child, where do I find out where these events are taking place so that I can bring my child or my loved one to this event?
So the American Dental Association has a list of all the events, because the way it works is these coordinators are supported by the ADA Foundation with donated products. So they know about events across the country, so you can always contact the American Dental Association through their website. You can also contact your local dental societies. So every state has a dental association, and even cities have their own dental societies. So I live in Los Angeles, and my dental society is the West LA Dental Society. And a lot of times these programs work with their local dental societies to get volunteers. So those are two easy ways to find out about, free clinics. And we also partner with a lot of like schools. So there's a high likelihood that your school nurse may know about a local program. But if not, you can always contact the ADA.
And doctor, is there a limit in terms of age? I would imagine it sounds like it starts with the school. So does it go all the way up to 18 years of age, or is there a cap on the age limit on
There's
the
no
age?
cap. Every program is a little bit different. So you would have to find a program that met your needs. Usually dentists are treating kids under the age of 18, and many dentists are treating kids even younger. We try to promote programs, or we try to encourage programs to see kids as young as possible. So we have a program called Tiny Smiles with the American Dental Association. It's part of the Give Kids a Smile program. And really what we're encouraging is that dentists start seeing kids by the age of 1. Okay. And so many dentists are a little bit reluctant to do that, but there's lots of evidence showing that if a child is seen by the age of 1, you can prevent a lot of future issues just by educating the parents alone. So we created the Tiny Smiles program, and we are encouraging Give Kids a Smile programs to try to host kids that are under the age of 3.
Yeah, and doctor, if I'm a dentist and or I'm in dental school, can I get involved? Do I just go through one of the local dental associations to try to get involved with this? I'm assuming that most dentists and dental students know about the American Dental Association, but how can they get involved?
So actually, I think 51 out of 71 dental schools actually do host a big Give Kids a Smile program. It's just really fun for students. And when you ask them over the course of 4 years of dental school what some of their favorite memories were, you will usually, if it's a school that hosts a Give Kids a Smile program, the students will usually name the Give Kids a Smile Day as one of their favorite events of the year. And then as far as a dentist who wants to get involved, they just contact the American Dental Association or their local dental society or their state association. And usually they will have a list of programs by geography.
Last question for you before we close out this part of the show, doctor. One of my favorite things about going to the dentist was either dipping my hand in the toy chest. I don't even know if they still do that, and also getting the grab bag that had my dental floss, my toothbrush, my toothpaste. Do these little patients get the same thing? Do they get I guess do they get to pick from the toy chest and do the same things that we did as young children?
Yes, so the ADA Foundation is really thankful for our partnerships with Colgate and Henry Schein, which is a large dental supplier, and other sponsors. And so we do give out, if requested, we give out product donations. And part of the donations are these oral health kits with toothbrushes and floss and toothpaste and a lot of educational materials. So it's really fun. And most clinics still, they don't have a grab bag anymore, but they do give out toys. And it just like, it's such a fun event, and it's a great introduction for kids in a really fun environment. So this whole stigma of like being afraid of the dentist is just gone usually when you walk into one of these Give Kids a Smile events. It's just a really fun atmosphere.
Yeah, really important. It sets the tone, doctor, for
Exactly.
the rest of your life. Doctor, I want to close out this episode, but I want to bring you back tomorrow, and I want to just talk about prevention if we could. So thank you so much for joining us, and we'll talk to you again tomorrow morning.
Thank you. Thank you for having me.
And don't forget to subscribe to our daily newsletter, The Morning Pulse, for all the news in one place. Details, of course, at our website. And your subscription supports all this great BRN content. And as I said, we're back again tomorrow for another edition of BRN. We'll bring back Dr. Sata to talk about prevention for children and for seniors. Until then, I'm Jeff Snyder. Stay safe, keep on saving, and don't forget, Roll with the changes.